Lordosis versus kyphosis. What's the differences and what are the similarities? Many patients are always concerned when they look at the front view of their spine and if they see any abnormal curvatures. They get concerned if they see a 5 or 10 degree misalignment or curvature from the front, or maybe 15. But when we look at spinal problems and what types of things we see more commonly in patients, we know the side view of the spine is more often out of alignment in much greater degrees than in the front view. And so what's so important about having these normal curves from the side? Well, we know the spine is not supposed to be straight from the side. It's supposed to have a curve. You're supposed to have a forward curve in the neck, a backwards curve in the mid-back, and a forward curve in the low back. And this is called the lordosis, a kyphosis, and the lordosis. And these S-like configuration makes the spine stronger, most importantly to compressive forces or mechanical stresses as a result of gravity or any type of compressive forces to the body. These normal curvatures make the spine move better and have more flexibility, meaning bending in certain directions are easier with these normal curvatures involved. And also it applies for optimal spinal mechanics. The spine is actually designed to have these curvatures to help distribute forces, deal with mechanical stress, and provide functional movement. So what happens when the spine loses these natural curvatures? First of all, these normal curves can either increase or decrease out of its normal range. And sometimes these curves can actually be completely reversed into an opposite position. And what it affects is overall biomechanics are disrupted throughout the entire spine, meaning just because you have a neck misalignment, it's not just affecting your neck, it's affecting the entire biomechanics dealing with gravity, because the whole system, meaning from feet to skull, are all reacting in time and need as a result of forces being placed, by compressive forces due to gravity. So we know if there's any type of misalignments, we affect the biomechanics throughout your entire body. Vertebra can also begin to shift or slip out of alignment. They can become misaligned. Sometimes it's just going to be called a bone out of place, or we can also use a word like a subluxation, where the spine isn't fully dislocated, but it's out of its normal alignment, which can have a whole other host of problems. And it can lead to other spinal conditions that involve when the spine loses its natural curvatures. And some of these conditions are something called like a lordosis, or if somebody has a hyperlordosis. So normally it's normal to have a lordosis in the neck and the low back. And we want these lordoses to be in a range. But if the lordosis becomes in excess, we call that a hyperlordosis. And a hyperlordosis is when the curve is too large, it's too big, it's too curved in the neck, and it's too curved in the low back. And the one in the low back can look something like a sway back, or something in the neck can have too much curvature in the neck. Now, you can also have a lordosis where you're supposed to have a kyphosis. A lot of patients, or some patients that are supposed to have a normal backwards curvature in the thoracic spine, can actually bend forward, and they have something called a lordosis in the thoracic spine as opposed to a normal kyphosis. What's a kyphosis? A kyphosis is the exact opposite, is when the patient has too much bending backwards in the thoracic spine, because that's where you're supposed to have a kyphosis. So again, it's beyond its normal range. However, you can also get kyphosis where you're supposed to have a lordosis, meaning you're supposed to have a lordosis in your neck and low back. If they bend backwards, then they're normal, meaning bending towards the back of the body. Now you have a kyphosis in your neck or a kyphosis in your low back where you're supposed to have a lordosis. Now, interesting enough, I've seen patients that have the exact opposite of what's normal. And instead of having a lordosis, kyphosis, lordosis, they actually have a kyphosis, lordosis, and kyphosis. And it affects the biomechanics of the entire spine and body. So this is not something to be taken lightly. Yes, it does affect posture. It does affect what you can see. But imagine like your car being out of alignment and severely out of alignment for years and years and years. All we're going to expect is abnormal car mechanics, and the abnormal car mechanics is going to lead to excess wear and tear on the machines and the shocks and the tires and the rims, and it's going to cause your car to prematurely deteriorate. Well, unfortunately, the same thing can be true when your spine's out of its normal alignment, and it affects the abnormal biomechanics. We expect, unfortunately, you're predisposed to have prematurely spinal degeneration and aging that's associated with this abnormal alignment. So when a lordosis and a kyphosis are considered outside of their normal range, then we call this person to have either a hyperkyphosis or a hyperlordosis. In the cervical spine, a normal lordosis should be about 40 degrees. That is considered ideal, but range is between 20 and 40. If somebody has something like 45, 50, 60, 70, they can have hyperlordosis. If somebody has less than 20, if they have 10, 0, or even bending backwards, they have a loss of cervical lordosis. In the lumbar spine, a normal range is about 40 to 60 degrees. However, 40 is considered ideal. If somebody has less, like 20 degrees, they have a hypolordosis. If they have beyond 60 degrees, they can have a hyperlordosis or too much curvature. And in the thoracic spine, the normal range is between 20 and 40 degree kyphosis. If somebody has 50 or 60 degrees, they have a thoracic hyperkyphosis. If they have less than 20 degrees, they have a hypokyphosis. And if they bend forward, they now have a thoracic lordosis. And I know this is confusing because the same word may be normal in a different area versus another area. So you have to know what's normal for that area. Again, cervical spine should have a lordosis, lumbar spine should have a lordosis, thoracic spine should have a kyphosis. So when you have hyperlordosis and hyperkyphosis, the first thing it affects is appearance. Like I said, posture. Hyperlordosis in the low back typically creates a sway back position where you have too much curvature, kind of like a butt back forward and an abdomen forward, like a butt back position and an abdomen forward position. This is what we tend to see in a hyperlordosis in the lumbar spine. A hyperkyphosis in the thoracic spine causes a rounding of the thoracic spine and shoulders, causes a pitch forward position that the person is leaning forward. Either way, if you have hyperlordosis, hyperkyphosis, you have this abnormal alignment of the side view or sagittal alignment of the spine. This leads to an abnormal biomechanics, which can lead to not only postural issues, but it predisposes you to spinal degeneration, spinal problems as you continue to age, and it also can lead to pain and loss of function in the spine. So we recommend trying to restore normal curvatures. The sooner is always better, because the sooner you start working on these spinal curvatures, they tend to worsen over time. And what worsens the spinal curvatures and these misalignments is just simple gravity over time. Gravity causing compression to abnormal alignment will increase the misalignment and cause things to worsen. So we recommend being proactive to help reshape the spine back into its normal alignment. This actually reduces the causes of the problems and allows you to stop the effect of the misalignments that can have over an extended period of time. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.